Hi, and welcome to Faculty Focus, a podcast supporting the clinical education community in Leicester. We bring you Educator CPD, showcase new initiatives, and shine a light on some of the faculty behind it all.
Okay, well, hello everybody. Welcome to the Faculty Focus podcast. Today we're going to be doing an interview episode, and today I've got someone who is involved quite a bit with the undergraduate side of things at UHL. We've got Chandra, Ohri. Well, actually, Chandra, I'll let you introduce yourself. Tell us a little bit about who you are and what roles you have in the Trust in Education.
Well, thanks very much, and thanks for the invite, Andy. So essentially, I'm a consultant respiratory physician at Glenfield Hospital, and I have a special interest in cystic fibrosis and bronchiectasis. I'm also currently UHL Senior Undergraduate Education Lead, as well as the Respiratory Medicine Undergraduate Co-Lead. And I also have a role with Leicester Medical School as an academic lead for medical specialties across the curriculum. By the time this is broadcast, I will probably be taking up a new role, which I've recently been appointed to, which is with Leicester Medical School as their Phase 2 Director of Clinical Studies.
Wowzers. Okay, that's certainly a very full plate, Chandra. I'm sure not all of it came all at once and sort of just landed on your sort of desk, if you like. But a lot of our listeners might be interested to know, particularly those who are starting off on their education journey, kind of how you got to where you are and all those kind of roles that you've ended up taking on. So I wondered if you could sort of tell us where it all started.
Yeah, absolutely. I mean, in fact, I would sort of probably go back to, my interest in education, which started even as a medical student. And I think really for me, one of the things that stood out and hopefully still stands out is that I perceived when I was an undergraduate that the great teachers were also great clinicians. And I think that was something which has really got me into sort of medical education in the first place. And I think also, I was lucky enough to do my undergraduate elective at Harvard Medical School. And actually, seeing some of the innovation and the culture of learning that they had there for their undergraduates and in the clinical placements was really impressive. And that's something which has never really left me. So, obviously as a doctor in training, I was also involved in teaching students, which I, really enjoyed doing. And I was particularly proud as a registrar to be sort of nominated as being one of the excellent tutors in the undergraduate arena locally. And again, that gave me some further, inspiration to really carry on with what I was doing as I moved into being a consultant. And, I think my more formal roles came as a consultant. So, for the past 9 years, I've held, a variety of undergraduate leadership roles. Initially, I started out as the cardiorespiratory block lead when we had the old curriculum in Leicester Medical School. And again, that's a role which was, really sort of satisfying, sort of having a lot of involvement with education leadership, but, actually a lot of education teaching delivery, both in sort of seminar format, but also, on the wards as well. And that's something which, really, I think set me up. And I think as a result of, doing relatively well in that role, I was given the opportunity to then progress. And then as we moved into sort of the new curriculum with Leicester Medical School, the cardiorespiratory block sort of evolved and merged as part of medicine overall. So I had the opportunity to become the medicine lead, both at UHL, but also within Leicester Medical School for undergraduate training. And then, more recently, just over a year ago, I was given the opportunity to step up to be UHL Senior Undergraduate Education Lead. So all these things have come in a stepwise approach. And I think really my advice to anyone who's interested in undergraduate or postgraduate medical education is just to get involved. What may seem like a very basic level to start with, such as just getting involved with things like bedside teaching, or getting involved with our faculty focus program, it can lead to other things. And I think, like I said, I think having that sort of feeling that if you're a good teacher, you are a good role model to others. And I think that's the sort of thing which we'd encourage everyone to get involved with going forwards.
Yeah, that's right. I think it's certainly it'd be interesting to know your sort of experience, but it feels like once you get over the first kind of hurdle and your name becomes sort of associated with things education, if you like, then stuff starts to be a bit like those roles start to come a little bit easier, or maybe you're sort of sighted to them. Is that something? Did you find you had to work quite hard to get to that point first, or were they all just?
Yeah, I think you're right. I mean, I think I often get approached by senior registrars, particularly, or newly starting consultants who are interested in getting involved in roles. And sometimes there's a perception that they need to sort of essentially have something in their job plan and be well defined and well ring fenced to start doing something. But actually, I think sometimes you do need to sort of lay down your mark, and if you're not established in a particular area, then you may need to just try and get involved, even if it's just, like I said, at sort of a very rudimentary stage, or even offering half an hour a week, or even whatever you can, really, in terms of however your job plan works. And I think that's important at all stages of training, whether you're a more junior doctor or even an
Yeah.
established consultant. I think sometimes you've just got to get involved if you want to sort of move things in the right direction in terms of your own interests and career.
Yeah, yeah, absolutely. And you've obviously had a lot of these roles, and your journey's been very incredibly varied. I wonder if a lot of us have role models and people we look to, whether it's clinical or in the education world. Were there any people that sort of stood out that were role models for you? People you wanted to kind of take those behaviours and attitudes on board, or?
Yeah, well, I'm very fortunate. Like, I work with a really current, excellent group of clinicians and educators, and I'm really fortunate to be in this environment that we are at the moment. But I think going back, I mean, I think the first role model was really when I was a sort of first year medical student in St Andrews Medical School, and our anatomy teacher was just wonderful. She was so sort of patient with all of us, but recognizing that that we'd sort of had that big transition from going to school into university, and she was so supportive, and also an amazing teacher. And I think, looking back, I would have really liked to have had her teach me more throughout the whole of the undergraduate course. And then also, as a sort of more senior medical student, I was lucky enough to have a vascular surgical placement in Manchester, and actually one of the registrars there was outstanding, and really, again, took his time, went out of his way to take us to see patients, to explain, what he was doing in theatre, but also, to sort of set some time aside in the week to actually do some knowledge-based development as well, which was really fantastic. And again, I think he was an excellent clinician. Probably partly because of his real interest in being an inspiring and excellent teacher as well. And then, when I came to Leicester 20 years ago, or just over 20 years ago, to start my core medical training, I was really inspired by two physicians at the time, Professor Thurston and Dr. Lowe, both now retired clinicians, but they were outstanding, educators, and really supportive, to try and get people involved, and really inclusive in the way that they sort of, behave. So those are the kind of people I think who've really inspired me, and I hope that I can, sort of try and continue to inspire others like they did to me.
Yeah, absolutely. I mean, I think sort of a lot of people have those sort of role models and are trying to sort of take on the sort of key qualities that they have. And yeah, it's really important to have those people around you in your development. Just thinking about some of the positions that you had that you mentioned at the beginning there. Thinking about some of the education work, what are the kind of big projects now that you're dealing with? What are you more focused on, and perhaps some of the challenges that go with one or two of those?
Well, I think, in my roles, if the primarily for sort of education, leadership, education quality, and development of our students, as well as our educating faculty. So those are really, in summary, the key things which I'm sort of continuing to focus on. I think at the moment, really a lot of work is going on in terms of quality assurance. So we work closely with the Department of Clinical Education at UHR, and also the Leicester Medical School Phase 2 team in particular, really trying to make sure that the quality of our placements for our students, is excellent, or if there are any deficient areas, really focusing on how we can improve on that. There are lots of sort of innovation as well in teaching, which is important. I'm really keen to support those. So, for example, we've had a lot of development with our live patient streaming recently, both in undergraduate medicine, but also now in surgery as well, which I think is really helping to complement our students, live patient facing experience. And I think also, one key thing which is really important, is of course the well-being and welfare of all of our trainees, but also of all of our colleagues and educators as well. And I think that's something which has been apparent to all of us and really highlighted to all of us as a result of the pandemic. And there's been a lot of focus on those aspects, which I'm very keen to continue to develop and support as we move forwards. And one sort of example of that is a recent quality improvement program that we've done at Glenfield Hospital, which was called the Undergraduate Teaching Liaison Associate Program, which essentially was trying to sort of empower our doctors in training a bit more to actually be sort of more of a liaison type role with our students when they were starting new placements. So, simple things that you might take for granted, but, essentially like showing students where to go, where they can have the breaks, it's sort of reinforcing timetables which had already been sort of put through, reinforcing, key learning objectives and outcomes for students to achieve in that particular part of the curriculum, and signposting them to the good patients really to sort of see for their learning development. So again, that's something which maybe sort of sometimes taken for granted, but simple things like that can really make a difference. And I think sometimes going back to some basic approaches like that, rather than just always assuming that we need high-tech innovation, I think we need this sort of balanced approach. So that seems to be working well. And of course, the work that you and I and other colleagues have been doing with the Faculty Focus program, I think, has been excellent, and that's something which I'm very excited and proud to be a part of. I think in terms of challenges, I think there are some generic challenges, I think, to working in the NHS and any education institution at the moment, which include things like, finite resources, trying to optimize how you use funding that comes in so that it's equitably distributed. Still getting lots of requests from, understandably, from different educators to provide X, Y, and Z. But again, you sometimes have to balance, the overall picture. And of course, there's the sort of the finite resource of space that we all have, which is a challenge for both our clinical, sort of activities, but also education in general. I think maybe more specifically, the most recent and pressing challenge is in relation to undergraduate education. It is really the rising number of students that we will have on placements, going into next academic year. So lots of work going on behind the scenes to try and ensure that whilst we have increasing student numbers in our clinical environments, we still maintain, high quality education.
Yeah, I think it's interesting you mentioned the sort of the balance between doing things innovatively and actually still delivering the volume of training or education that's needed, because it's really tempting to sort of go down that innovation, the technology side of things, and that's fine provided it can sort of link in or align with all the other activities that are ongoing. So yeah, constant battle, and it's really it's not the thing you want to do when someone comes with an innovative idea to sort of say, well, we can't do that because of X, Y, and Z. It's a real shame, isn't it? So yeah. Incredibly difficult balancing act to do. Right, okay, so we're going to come to a slightly more insightful part of the podcast. It's called Who Are You? And we've got an incredibly it's a highly validated method we're going to run through. It's called the quickfire round, and it's just to give us a little bit of an insight into some of your preferences and sort of where you are with these issues. So I've got 15 questions, and it's quickfire, so I just need you to tell me which one you prefer, you feel more aligned with, and then we'll discuss at the end. Okay, are you ready?
Okay, yeah, let's go.
Okay, right. Okay, here we go. Tea or coffee?
Coffee.
Pen or pencil?
Pencil.
Line paper or plain paper?
Plain paper.
Plain paper. Hot or cold?
Hot.
Email, phone call?
Phone call.
2 wheels, 4 wheels.
4 wheels.
Think or do.
Do.
Sun or snow.
Sun.
Sun. Okay. Shower, bath.
Shower.
Rugby or football.
Rugby.
Test cricket or 2020.
Test cricket.
Succeed or fail.
Oh, succeed.
Okay. Do as I say, do as I do.
Do as I do.
Learning or teaching.
Oh, that's a good one. I think teaching. Gotta go teaching.
Okay. Plan ahead or day before.
Plan ahead.
Plan ahead. Yeah, that's a very sensible answer there. Very interesting responses there. Succeed instead of fail. Do as I do. Yeah, I think I knew the kind of rugby football one. Yeah. So insights there. What sort of person do you see yourself as then? I don't know if you've probably done lots of these Myers-Briggs type of things and personality types. Certainly, the higher up in the leadership world you go, you tend to sort of come across these things. So, what sort of characteristics do you think sort of sum you up?
I think I've actually changed a lot, which I think is an important thing to highlight, because I think sometimes we don't recognize at different stages of life. You I guess your sort of innate personalities very very similar, but actually certain traits can evolve quite a bit. So, for example, I thought I was a very introverted type of character when I was younger, particularly as a sort of teenager and moving into medical school. But actually, now I sort of, feel very comfortable in a social situation and, sort of in a work situation, trying to sort of be somebody who will bring everyone else together into the conversation. So I sort of feel like I try to be an inclusive person. I don't like working with lots of hierarchies and barriers. I think, making sure that other people are heard and involved. So I like to think I'm a team player. I guess I've got some evidence for that from my MSF or things like that. So, but I think those are sort of the key things. And I always sort of pride myself on trying to be compassionate and empathetic, and I think I always have been from a young stage in life. But I think, yeah, it's an interesting point. I think Myers Briggs, sort of, for example, would actually change, if over time.
Yeah. No, it's interesting, isn't it? It does feel that sort of confidence plays a lot of sort of a big role in how you sort of come across and how you conduct yourself in
Yeah.
whichever environment that is, isn't it? So yeah, if you're kind of starting out in your career, you do feel a little bit more introverted for sure. And so how do you sort of balance a lot of the work that you're doing? What do you do in your downtime? Do you have any sort of hobbies or activities you like to?
Yeah, so really just sort of spending time with the family. I've got two kids who are 13 and 11 at the moment. So again, we just try and do sort of family stuff, try and get outdoors as much as possible when the weather permits. At the weekends, I also do try and watch quite a bit of rugby. Pretty passionate about watching that. Sort of got obviously links to watching Leicester Tigers, but also from where I'm from originally, Glasgow Warriors. And depressingly, at the moment, the Scottish rugby team as well. So I also enjoy playing my electric guitar as well. So those are the things that I try and sort of do when I get some spare time.
That's great. That's a really eclectic mix there. Yeah, no, lovely. And what's sort of thinking about the work that you are involved with? What are there any? I suppose you've alluded to some of it already, but are there any particular aspects that you really enjoy, that you really like about that work, and conversely, are there any things that you really dislike about it?
Well, I think I do feel lucky, and I do feel that I've been able to, with some hard work as well over the last decade, sort of evolve my job plan to something that I really I feel that I've got a good balance with, to sort of promote my main interests. So I think I've got I think I've got a good balance now between my education roles versus my clinical work as well. I still really enjoy obviously training our postgraduate doctors in training as well as our undergraduates. So, find that very satisfying, particularly spending a lot of time with our registrars and our core medical trainees and our foundation doctors and helping with their progress as well. But I am really grateful. I think I've mentioned already. I think I do work in a department, with really some outstanding clinicians and academics, as well as colleagues across the education front, both at UHL and the medical school.
Yeah, sure. And how is so one of the things that's a big topic in UHL is the reconfiguration that we're kind of undergoing. Has that really affected you, and is that something that a lot of yourself and your work colleagues are talking about? And do you sort of see it as an opportunity or as a big stressor in your day-to-day activities?
Yeah, I think there's always opportunities with these kind of big projects. I think obviously clearly it's impacting on the Department of Respiratory Medicine. Being a one of the sort of key specialties at Glenfield, where a lot of the changes are happening. And I think things like sort of wards sort of sometimes moving from different areas to different areas. So, for example, in the pandemic, we identified actually that we needed the best ventilated wards, which made sense to host our severe respiratory infection patients. And actually that wasn't a respiratory base ward initially. That was something which was custom built for one of the newer services to come across to, or sorry, not new, so one of the established services to move across from one of the other sites. And obviously now, they're looking to reclaim the area that, essentially was, in fairness, what they'd be planning for some time. So I think that's something which is going to be a challenge. I think going into sort of winters for our department, like every department in the NHS, is a challenge, but particularly when we are mindful and more aware of the problems with respiratory viruses, particularly. And I think going into the future winters, I think that's going to be the ongoing challenge of us having the right place, the right ventilated areas. And I think that's an ongoing challenge in clinic as well. I do find that even with my work as in the cystic fibrosis department, we constantly looking at ways that we can improve our environment in terms of patient safety. And that's, I think, again, not unique to us, but certainly one of the ongoing things which need to be considered with the reconfiguration project.
Yeah, no, it's a huge piece of work, isn't it? And we've got some moves coming up in the next few months. So yeah, watch this space. Okay, well, we're sort of coming towards the end of the interview now. I just wondered if there were any sort of final messages, really. If we're looking at a young educator, budding educator, or a teacher now, are there any sort of take-home points or any sort of pointers you would you would sort of offer them?
Yeah, I think it's just highlighting some of the things we've already mentioned, which is really, just get involved as soon as you can. So if you've got interest, no matter what, aspect you can get involved with. An example using undergraduate teaching is getting involved with bedside teaching, but ask around, try and find a mentor in the department that you're working in that has an interest in education. I think that would be a really sort of good step forwards to get more involvement in other opportunities such as quality improvement activity and maybe more formal teaching opportunities as well. I think being part of our faculty focus program is really a great initiative. And again, through that, we showcase, some really great examples of good practice throughout the trust, but also, collaborative ideas for new projects. And also we advertise, opportunities. So I think those would be sort of my top tips for anyone who wants to embark on a career, allied to medical education.
Well, that's brilliant. Thank you. Thank you so much for taking the time to come and speak to us, Chandra. I've certainly got a better idea of some of the work that you do outside of education, because I sort of have an idea of the work you do with education. But yeah, and I'll be interested to see how some of those plans and projects turn out. So thank you very much.
That's great. Thank you, Andy.
No problem. So to our listeners, don't forget that we also have our monthly faculty focus grand round style meetings where you can find out what work is being done by our educators in UHL. They're held on different days during the week, but always 1 till 2 in the afternoon. The dates can be found on the Department of Education website, and if you would like to be added to the mailing list, then contact myself or Chandra on the internal email address book. And that's it for today. Look forward to seeing you on the next podcast. Thanks for listening. Bye.
Thanks for listening to the Faculty Focus podcast. If you like the episode, please share with friends and colleagues. You can also like and subscribe to the show, and perhaps even leave us a review. Clinical education can be tough, but we are stronger as a community, so if you have an idea for an episode or would like to come and talk to us, do get in touch via email or Twitter. Details in the show notes. The Faculty Focus podcast. Community Development Showcase.